Good afternoon, friends. Today we have Dr. Sameer Bhati with us. He's from Star Imaging Group. So they have a chain of diagnostic centers across India, and he's been given the Atal Award, Achievers Award, I believe. And this is at the Vigyan Bhavan, so it's a very prestigious moment for Dr. Saab. So, sir, as people were talking about the corona wave, although I didn't want to touch that subject, but we can start with that. So, what do you think, sir, was the position now with the third wave emerging and lockdown hanging in front of us?
Right. So if you talk about this new emerging variant Omicron, if we'll talk about Delhi specifically, I mean in Delhi we have around 90% of herd immunity. In Delhi specifically, we can say almost 90% population already infected from the Delta variant.
So without the vaccine,
without
they are
the,
still going
yeah,
strong.
exactly. So we can say we have the natural immunity as well as the vaccine-initiated immunity.
Right.
So what I feel, I mean, this Omicron variant, and as per the data, this variant is transmissible, but not that lethal as the Delta variant. But still, we have to be cautious.
There's some Institute of Health, Elementary Health. So I just got a report from there, one of my friends shared. So they are saying that a lot of billions of people between the age group of 25 to 30 would be worse affected across the world.
So the young people, if we talk about, I mean, they are moving around, no?
Yes,
They have to go out for their, for their job, for their business. So in that aspect, you can say they are affected. But this Omicron is, affecting every age group. It's nothing like that. I mean, it specifically will affect the children or the youth or the specifically population. But the people who are comorbid, we can say
they
people,
have more risk.
they are more risky.
They are more asthma patients.
Asthma patient, the uncontrolled diabetes or the hypertensive or the people who are having the cardiac elements and all.
Right. So we'll come to your profession, sir. So how long you been this into the medical profession? So you could give your introduction.
So we are running a chain of diagnostic center. We are in the diagnostic Star Imaging and Path Lab. So we have around 70 centers in Delhi and NCR.
Right,
and we are running some PPP models and also. So we are into the diagnostic. All kind of radiology and pathology, and we have the molecular lab, the COVID lab also. We are doing the COVID testings as well in the Delhi.
Excellent, sir. So how do you feel about getting the award today? You're being recognized in the field of...
It's been always a pleasure to receive these kind of prestigious awards from the dignitaries.
Yes,
so
sir.
definitely these kind of award, inspire and motivate us.
Right. And you want to tell anything for the youth? Because today youth is not, they are having a lot of gutka, and there was a little controversy with the wine and beer shops opening up. I see the young children. Now the age of girl, has been increased from 18 to 21 for the marriage. So I was having a discussion that this is going to really be, socially relevant. Because as India, as a country, we are such a huge population. So I want you to give a message to the youth about drugs and no smoking and, whatever, sir. Any message?
See, if we'll see the data, I'll talk about the scientific part of it. If we'll see the data, India is become the capital of the diabetes, the cardiac issue, and now the cancer. So the youth who's taking these tobacco and other substances. So what we have seen, I mean, you have seen the youth cardiac issues, heart attack and everything. So you cannot say there is a age for the disease. And specifically, if we'll say the cancer, the oral cancer, which is specifically caused by this tobacco chewing.
Right,
So definitely, I mean, they have to avoid it.
Right. I only, whenever I see somebody, young people driving e-rickshaw, तो वो छोटी उम्र होती है, मैं उनको बोला भैया तुम पैसे अपने स्पेंड कर रहे हो, but this is going to lead you to a very bad situation in the future. So उसने फेंका सर, and अगर if I could spread that message, so that was I was. So thank you so much for speaking to us, Sanjay Agrawal. Thank you.
ठीक.
I'll share you sir.